Hello, everyone. Thank you for signing on with us this afternoon. We want to welcome you to COVID-19, Shedding Light on the African American Experience. We are student pharmacists from Florida Agricultural and Mechanical University, College of Pharmacy and Pharmaceutical Sciences, Institute of Public Health. I am Maya Palmer, and I'm a fourth-year doctor of pharmacy candidate from Chicago, Illinois.
I am Alexandra Bartley, a fourth-year doctor of pharmacy candidate from Sarasota, Florida.
And candidate from Chattahoochee, Florida. We are under the supervision of Dr. Charlie Colquitt and Dr. Salika Sampson. Today, we will be discussing the impact of COVID-19, statistics on COVID-19 and the African American population, Americans contracting COVID-19 and dying from it, effective safety measures to combat COVID-19, and trusted resources to further educate and or give assistance. The overall purpose of this webinar is to provide fast facts and education on the disproportionate impact of COVID-19 on African Americans and give solutions that could help reduce the risk. We will begin this afternoon by asking you all a few questions to assess your knowledge and understanding of COVID-19's impact from a statistical data standpoint. So the first question is, among the U.S. counties that are disproportionately represented by African Americans, what percentage did African Americans account for COVID-19 cases? And if you can, please type your answer in the chat box. Is it A, 22%, B, 42%, C, 52%, or D, 82%? You will have about 10 seconds to place your answer in the box. %. Assessment question 2. Among the U.S. counties that are disproportionately represented by African Americans, what percentage did African Americans account for COVID-19 deaths? A, 88%, B, 58%, C, 28%, or D, 18%? So if you selected B, you are correct, 58%, an astounding number. Question 3, which of the following is true? Is it A, non-Hispanic Black persons have a rate of approximately 2 times that of non-Hispanic whites for age-adjusted hospitalization? Is it B, 3 times that of non-Hispanic whites, C, 4 times that, or D, 5 times that of non-Hispanic whites for age-adjusted hospitalization? Again, you have about 10 seconds. So as you can see, it's D, 5 times that for hospitalizations. Assessment 4. Why are some racial and ethnic minority groups at a higher risk during pandemics such as COVID-19? This question is a select all that apply, so more than one answer could be correct. Is it A, living conditions, B, work circumstances, C, health circumstances, or D, none of the above apply? Thank you all for your participation. So if you selected A, B, and C, you're correct. Living conditions, work circumstances, and health circumstances all attribute. And finally, assessment question 5. As of June 2020, which of the following ethnic groups had the highest age-adjusted COVID-19 hospitalization rates by race and ethnicity? A, non-Hispanic African Americans, B, white Americans, C, non-Hispanic American Indians, R, Alaska Natives, or D, both A and C? Again, please type your answer in the chat box. So for those of you who selected D, both A and C, you are correct. Thank you.
The coronavirus is a severe acute respiratory syndrome virus. There are a few signs and symptoms, but the main ones are cough, shortness of breath, and fever. Also, there are people presenting with a nose. Currently, there are about 146 million confirmed cases and 600,000 deaths in the world. COVID-19 has been reported in every state in the US. There are over 4 million cases and 100,000 deaths in America. Blacks have a rate 5 times that of a white person. Fast fact is in the US, 52% of the COVID cases and 58% of the COVID deaths are African Americans. Here you can see by the graph that African Americans are the second leading race behind American Indian and Alaskan Natives for COVID-19 hospitalizations, and whites have the least. The most common COVID test is the reverse transcription polymerase chain reaction nasal swab. The test that is currently being developed is the influenza SARS-CoV-2 multiplex assay. This test will detect. This test should be finalized around flu season. The antibody test is used to test for a past infection. A positive result shows that you may have antibodies. A positive result may also mean that you have antibodies from an infection with the virus from the same family of viruses called coronaviruses, like the one that causes the common cold. A negative result means that you never had COVID-19. A fast fact is that neither the diagnostic or antibody test can confirm whether or not you are able to spread the virus that causes COVID-19. As we all know, countless vaccines produce our live vaccines. Influenza and polio. Effective, this process can take years to create a vaccine. Currently, a brand new type of vaccine is being tested. This type of vaccine does not contain any part of the virus. Genetic engineering is used to capture part of the DNA or RNA. These vaccines use the DNA or RNA of the coronaviruses, which will activate an immune response. The difference between a live vaccine and this new vaccine is that it does not require for the virus to grow like the live vaccine. Unlike a live vaccine, this new type of vaccine can be made quicker and with more efficiency. Although this method may seem effective, we cannot determine how safe it is because it has never been approved for use in humans. Moderna is developing a mRNA vaccine. Their clinical on July 27th. Oxford AstraZeneca vaccine, known as AZD1222, is developing a non-replicating viral vector vaccine. Phase 3 of this clinical trial started on June 20th. And according to the World Health Organization, AZD1222 is one of the potential COVID-19 vaccines that are being tested in clinical trials. Currently, there are 25 coronavirus vaccines in clinical trials and more than 140 in preclinical studies. Two major companies, Pfizer and BioNTech, recently announced an agreement with the US government. The government ordered 100 million doses for $1.95 billion. Trials are anticipated to begin at the end of July. These two companies are expected to be in the upcoming news. Let's walk through a little patient scenario to see how easily COVID-19 can be spread. MB was made aware that she had been exposed to someone with COVID-19 on June 11th. On June 16th, 5 days later, MB decided to get tested. Her test results came back negative. MB thought it was okay to go to a family cookout on June 19th. MB exposed every family member or friend that she came in contact with. A few days later, now even though MB got tested, she got tested too soon, and therefore she received a false negative result. How many days can it take for you to test positive for COVID-19 after exposure? You can write your answer in the chat box. Okay. It can take up to 14 days. Also, if you think you have been exposed, it is best to wait to get tested. If you think you have been exposed to COVID-19 and you are asymptomatic, symptoms. Now, if someone presents with symptoms or comes into contact with a known positive, they should get tested as soon as possible. It is important to prioritize symptomatic patients first.
MB probably exposed her friends and family to COVID-19 because she was misinformed and are asymptomatic. So I pose a question to you as the audience. What are some of the things that you all have heard from friends, family, or those in your community regarding African Americans and COVID-19? Please put your answers in the chat box below, and we will address those during our question segment.
Now we are going to shed a little more light on the African American experience with COVID-19. Non-Hispanic African Americans are almost twice as likely to be uninsured compared to non-Hispanic whites. This has resulted in the higher likelihood of minorities reporting not being able to see the doctor because of cost. There's also a strong generational distrust in the healthcare system among African Americans. There are issues of language barriers, lack of cultural sensitive healthcare, between government or healthcare entities and minorities. This may cause some people to dismiss the importance of directives from public health and government officials during this pandemic. Among African Americans, there are also higher rates of chronic illnesses at earlier ages, such as diabetes or hypertension, as well as higher death rates. These underlying health conditions compromise the immune system and places people at much higher risk for complications with COVID, which we have seen a lot of those results today. Stigmas, systemic inequalities have heavily undermined prevention efforts, increased levels of stress, and ultimately sustained health and healthcare inequities that we see. There are certain diseases that according to CDC, some of those diseases include cancer, chronic kidney disease, diabetes, obesity, as well as sickle cell disease. And among these listed, even though African Americans are only about 13% of the US population, we are most often the leading ethnic group, placing us at a higher risk of more severe COVID complications. For instance, white Americans, and the highest incidence of sickle cell disease in babies born with sickle cell trait in the US. Going more in depth with a few of these conditions, starting with diabetes, the percentage of African Americans with diabetes has actually decreased in recent years from 12.5 to 11.7%. However, this still places us in the third leading ethnic group diagnosed with type 2 diabetes in the US. According to MD Anderson Cancer Center and the American Cancer Society, the incidence of cancer diagnosis in general are the highest among African Americans. Of significant importance are those diagnosed with lung cancer. As you can see here, it's the highest rate in African American males. With the lungs being a respiratory organ and COVID-19 being a respiratory disease, it makes it very difficult to combat COVID-19 if infected. There are going to be some helpful resources available at the end of this presentation to help you or your loved one quit smoking, which is one of the leading causes of developing lung cancer. Obesity is another disease that places individuals at a higher risk of severe complications. As you can see from the bar graph, as of 2018, African American women lead amongst those who are obese in the US at 56.9%. African American males are not the highest, but their numbers come in at 41.1%. And of all the ethnic groups mentioned, African Americans combined lead in incidence with almost 50% of those diagnosed with obesity over just the age of 20 in the US. In a report published by the CDC in 2016, African Americans made up about 40% of all groups diagnosed. African men and women lead amongst those ethnic groups with the highest incidence of high blood pressure. Now we're going to talk about the African American work experience. So some lines of work and policies can actually put workers at a higher risk of getting COVID. African Americans are more likely to work in these conditions in industries like healthcare, grocery stores, factories, and even public transportation. African Americans who are especially essential workers have a higher risk of infection simply because they have to be at their work sites despite the pandemic going on and may need to continue to work due to economic circumstances. For workers who do not have paid sick leave, they are more likely to continue to work even if they get sick or have symptoms. On average, minorities see a much larger gap when it comes to income, accumulated wealth, and education compared to white Americans. These individual factors can affect where people live, learn, and work, and can have a huge impact on health outcomes as well. And one last component that has negatively impacted health has been living conditions. African Americans are more likely to live in densely populated areas due to institutionalized racism in the form of segregated housing, often resulting in multi-generational or multi-family households. These conditions make it much harder for the practice of social distancing, as well as harder to protect family members who might be older, or even isolate members of the family who might become sick with limited space in the household. Also, in some neighborhoods, might be farther away from them. There's even instances where reliable transportation simply might not be available. And lastly, as far as living conditions, African Americans are overrepresented in jails, prisons, homeless shelters, and detention centers. These environments, where it's also densely populated, can make it very difficult to slow the spread of COVID-19.
Since we have heard some of the problems surrounding the African American experience with COVID, now we will address some potential solutions and very important practices that not only Americans should implement into their day-to-day lives, but everyone should implement. Implementation of some of these common sense safety measures can reduce the spread of COVID-19. First, know how it spreads. Currently, there are no approved vaccinations. The best way to prevent it is by avoiding contact with the virus. The virus is spread from person to person within about 6 feet of one another by an infected person coughing, sneezing, or talking, and those infected droplets landing in one's eyes, nose, or mouth. Cover coughs and sneezes. Use a tissue if possible. If not, use the inside of your throw away the trash. Immediately wash hands with soap and water or use hand sanitizer. As equally important, clean and disinfect. Clean and disinfect frequently. Everyday touch surfaces. For example, phones, switches, tabletops, doorknobs, toilets, faucets, and sinks. If surfaces are dirty, clean them first with soap and water, then disinfect them. Another very helpful practice is to wash your hands often. Use soap and water, especially after being in public places, coughing, sneezing, or blowing noses. Wash hands before eating, after handling or touching pets. If no soap and water is available, use hand sanitizer with at least 60% alcohol contents and cover your whole hand by rubbing them together with the sanitizer until they are dry. Avoid touching your eyes, nose, face, or mouth until your hands are washed. Additionally, you should avoid close contact. Inside your home, avoid close contact with people who are sick. Outside your home, maintain 6 feet, which is about 2 arm lengths, away from others. Keep distance from those who are at higher risk of getting sick. For example, the elderly, which is someone over 65 years old. Monitor your health daily. Watch for cough, fever, shortness of breath. Do not take your temperature within 30 minutes of exercising or taking Tylenol or Motrin or any fever-reducing medicines. Cover your mouth and nose with a cloth face covering around others. The covering is meant to protect others in case you are sick. The covering does not mean omit the 6 feet social distancing safety precaution. Face covering should not be placed on anyone under 2, anyone with difficulty breathing, or anyone who is incapacitated. And finally, last but not least, take your medications if a fever occurs and follow the CDC guidelines mentioned above. Since we have discussed what everyone can do to make it more safe and prevent the spread of COVID-19, a little more into different roles of healthcare providers in the community in preventing and reducing the incidence of severe cases of COVID in the African American community. Some of the tasks that pharmacists can do are perform COVID-19 testing. Also, pharmacists can educate patients on safety and preventative measures as mentioned previously. Also, pharmacists can connect patients with resources, and lastly, promote a trusting relationship by encouraging patients to call and ask questions. Communities play an important role also and can help by doing the following: by prioritizing resources for clinics, private practices, and other organizations that serve minority populations. Work across sectors to connect people with services such as grocery delivery or temporary housing that can help them practice social distancing. Connect people to healthcare providers and resources to help them get medicines. They can also help by stopping the spread of rumors and misinformation by providing information from trusted and credible sources. Speaking of credible sources, for you to refer to for valid information, a lot of the problems that surround the African American experience with COVID-19 largely deal with misinformation and myths. That is why we have provided a brief list of reputable sources for you and your loved ones to refer to if you need better understanding health care, among other things. They can be found here. If you would like, you may take a screenshot or picture of this slide for future reference. The slides will also be posted on the FAMU COPS IPH website. Now let's review the earlier questions to shed light on the African American experience with COVID-19. Again, please put your answers in the chat box. You should be a little more familiar with them now. So this time you'll have about 5 seconds. Assessment question 1. Among the U.S. counties that are disproportionately represented by African Americans, what percentage did African percent, C, 52%, or D, 82%? And the answer is C, 52%. Assessment question 2. Among the U.S. counties that are disproportionately represented by African Americans, what percentage did African Americans account for COVID-19 deaths? A, 88%, B, 58%, C, 28%, or D, 18%? And the answer is B, 58%. Number 3, which of the following is true? A, non-Hispanic Black persons have a rate approximately 2 times that of non-Hispanic whites for age-adjusted hospitalization? Or is it B, 3 times that, C, 4 times that, or D, 5 times that? You got it if you answered D, 5 times that of non-Hispanic whites for hospitalizations. Question 4. Why are some racial and ethnic minority groups at higher risk during pandemics such as COVID-19? Select all that apply. Is it living conditions, work circumstances? All 3 contribute. And question 5, as of June 2020, which of the following ethnic groups had the highest age-adjusted COVID-19 hospitalization rates, race and ethnicity? A, non-Hispanic African Americans, B, white Americans, C, non-Hispanic American Indians or Alaskan Natives, or D, both A and C? And if you chose D, you are correct. Thank you again for your participation.
We are now open for any questions or comments that you may have. Please feel free to type them into the comment box, and we will do our best to answer them.
So we did have a question that came in earlier. The question was, do we know if males have been more affected by COVID than females? So as far as cases, males actually have less reported cases, but more deaths. So females have 51.6% of cases, males have 48.4%. And so for deaths, females are less, and males have more with 53.9%, and females have 46.1. These are numbers that were recently updated as of yesterday.
Another socioeconomic disadvantages. So just breaking the word down, the distribution of wealth, consumption of goods or products or services. Basically, socioeconomics deals with the disadvantages, deals with the disproportion of the spread of wealth in society, which may be due to education, income, or occupations. And as we know, a lot of times minority socioeconomic groups are those who are more disadvantaged due to some of the circumstances surrounding their communities or what have you, the resources that are available. That was a good question. Thank you.
Those percentages were by gender. They were not characterized by the race for the male and female.
Someone wants to know, it says that COVID-19 morbidity and mortality are very high in Florida. Do you have thoughts as to how Florida could reduce these? I do have thoughts on that. I think that Florida can implement some of the safety precautions that we mentioned earlier. And also, this may be more of a personal opinion from person to person, especially dealing with politics. So I'm not really going to get into that. But we just need to take, people should feel like because things are opening back up, then it's safe. Sometimes we have to use common sense practices that are important for ourselves and our families. Like making sure that you're disinfecting, wearing the face coverings, making sure that there's social distancing. Maybe Florida can implement more curfews and guidelines to help facilitate that with some who are a little bit more lax. But again, that's getting into the politics of things, so I really don't want to go down that road.
So good question popped up. Any thoughts on how to get more African Americans involved in the testing of these new vaccines based on the history of distrust in healthcare and research? Okay, so Maya, you can go first if you have your opinion.
Okay, I was chime in quickly before your question. Someone mentioned hand sanitizer. Guideline around recommendation is to not purchase any hand sanitizers that contain methanol in them. Methanol on the consumer listed, those are not recommended. Hand sanitizers with 60 or 70% ethanol are
Back to the vaccination. It is important to have different races try out these vaccines so we can know how they can react, and getting more African Americans involved is more people are going to have their own to get African Americans to partake in these vaccination trials by letting them know what they're receiving, the possible side effects, and the benefit for humanity that they could possibly.
And to add on your answer, Alex, I would, my personal opinion would just be for more Black healthcare professionals to kind of get into the community, really disseminate the truth about COVID and what's going on in the African American community, to let our community know the clear message that we are being disproportionately affected, and even by providing more health and wellness information so that the community is aware of preventative measures, I think representation would really help.
I agree. Another question, what do you feel like the College of Pharmacy can implement in order to keep the students safe that have classes in person? I feel guidelines and standing 6 feet apart.
Yes, also frequent cleaning, making sure that, we disinfect and sanitize regularly. The FDA has approved sanitation chemicals that can be used that are effective for keeping surface areas clean. And like my colleague said, making sure that we can social distance as much as possible, and everyone wearing their mask according to CDC guidelines. Another question came in about how likely are children to spread COVID-19. From a statistical standpoint, I would have to get back with you about that, but I can just say from experience, children are still very likely to spread the virus, just like if it were the flu virus. We know that children like to touch a lot of things. They often, depending upon the age, spread the virus, as this type of virus is passed by respiratory droplets. So that can include saliva, and if it's on their hands or surfaces, then it can be transmitted to other persons as well, other than children, or from child to child. Thank you all for all the positive feedback. I'm trying to see if we could answer everyone's question.
And just a final question that we had submitted: what long-term community outreach can we do to continue to educate the community to conduct safe practice? And just to tie in what I mentioned earlier, definitely getting more Black healthcare professionals involved, and even just using the community to help spread the facts and the information about COVID can help as well.
Yes, I would like to say that I think sometimes when African Americans may see someone who looks like them or who is relatable in a sense, then they may be more comfortable or receptive to some of the information. There's been a lot of distrust surrounding the African American community, and the whole health experience in the United States. So those of us who are in position where we can influence those or educate African Americans, it is very important that we do so. so that they can, feel free to ask questions or what have you. And there's actually resources that are available to those health providers to give, like a cultural type educational background on how to be able to better communicate with minorities or people who are disadvantaged.
And even joining town halls just like this, tuning into town halls that spread more information about COVID. And we'd also like to commend our Institute of Public Health as well for the information. So if we do not have any questions in, on behalf of Block 2, academic preceptors, Dr. Colquitt and Dr. On behalf of my colleagues, I would like to thank you all for your attendance, your participation during today's session, shedding light on the African American experience. And we really hope that you all enjoyed this and that you've taken in the information, and take care and stay safe.
Thank you all.
Thank you.